Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director. Today is Tuesday, November 10th, giving you the update from Albany Med. All right, Fred, sometimes we start with birthdays or special events. So today is a very special birthday.
It is.
245 years old.
Yes, very old.
The Marine Corps. We celebrate the
Ruha.
Yeah. Happy birthday to the United
Happy
States
birthday.
Marines. Very important day. Okay. Today, Fred, we're going to focus a lot on COVID. There's been a lot in the news lately, and there's really quite a bit to talk about.
Yes, there is.
So let's jump in and we'll throw up the first graph. I think people will recognize this is the 8 counties of the capital region, and it's very obvious to anyone who's looking at this graph now. We're seeing numbers go up. Mm-hmm. We said a couple weeks ago that the value in having this data is we could see what's going to happen. When we were at our low point, Fred, in the hospitals in the capital region, we had 15 admissions.
That's right.
Today the number's 116.
But an interesting caveat, Dennis, if you look at the number of ICU patients,
Yes.
I think it's 16 today or yesterday on that graphic. If you go back to the last time we had 116 or so people in house, it was twice as many.
Interesting.
So a little bit different profile of the hospitalized patients.
And you've been talking about that for a while, so as we're seeing an increase in admissions, the characteristics of them in the hospital are slightly different.
They are.
But nonetheless, we are paying very close attention to the number that actually come into the hospital, and that number is going up. Let's take a look at activity here inside the medical center. Above the graph would be admissions, and below the graph primarily would be discharges. And you can see, Fred, over the last couple days, we've had days with 3, 4, 5 admissions on any particular day. You can also see one day there with a little yellow above the horizontal line, and that's a flu admission, and we're tracking that as well.
Right, our first flu admission.
So what does that mean? That means here today in the medical center, we have 26 admissions to the hospital, 21 on the floor, 5 in the ICU, 2 on a ventilator, and that 1 flu admission. So 26 is one of the higher numbers we've had now in quite some time.
That's right. Really have to go back to the spring in May to be at that level.
Now, Dr. Ostroff was here last week, and she was talking about how the good news is primarily the admissions to the hospital have been with the adult population.
That's right.
Children still not really part of this number.
So there are no children in hospital, haven't been going back all the way again to the spring. So none in-house right now.
So for those who are getting admitted, still primarily the vulnerable populations, older, obese, hypertension, diabetes, heart disease.
All the same risk factors. That's
All right,
Dennis.
very good. So Fred, let's talk about some other things related to COVID. As you have led us through a region of talking with other area hospitals, we're trying to standardize the things that we do so that what happens when you go into a hospital is the same on this campus and other campuses.
That's right.
One of the things that we as a region have been trying to do is work on visitor restrictions, and I think we have an update about that.
That's right, Dennis. I think it's very important that we try to act as a regional system of care providers, and that's really been embraced by the other institutions in our region. So we began talking about this about 2 weeks ago. Last week we got a little bit more serious about it. And we've decided as a group that we're going to change our visitation policy. So St. Peter's actually has already started. They started on Saturday.
Yep.
We believe Ellis is starting this week, and we're going to start tomorrow. And here's what we're going to do. We're going to go back to the more restrictive visitation policy that we had back in the spring. So that means visitation will only be allowed for end of life, when someone is actively dying. A child can have their guardian or parent, and a laboring mom who can have a labor partner with them. We also have an exception, a compassionate exception policy. So on a case-by-case basis, if there's another reason for someone to come in, we're going to allow that as well. So that's going to go in effect at the medical center tomorrow.
And I think it's fair to say that we as a region have decided to do this really out of an abundance of caution.
Absolutely.
We're trying to be proactive. We're seeing visually the numbers go up, and we're saying let's be sure that we do things safely and let's try to keep the visitor restriction in place until we can see what happens with the numbers.
That's right, Dennis. We have a lot of vulnerable people
Right.
in the hospital,
Right.
people who are sick with other illnesses,
Right.
and we really want to prevent them from getting COVID as a result of a visitor coming in.
Now, we know to many people who have family members in the hospital, you want to be at the bedside, you want to communicate with them. So one of the things that we've been talking to our workforce about is let's be sure we go above and beyond to try to be sure that we do what we can to open up alternative ways of communicating with family members. So we'll use technology, we'll use iPads, we'll set up phone calls, we'll call family members, but we're going to try to do everything we can to continue to communicate with those patients.
That's really important, Dennis. You know, it's as important as the physical care we're providing for those patients.
Yeah.
So you mentioned iPads. So we actually have 50 iPads
Great.
mounted on what we call sticks
Right.
that can
Right.
move around, and those are going to be deployed to all the units, so there can be some video face-to-face with patients and family members.
All right, great. Let's throw out another term that people on this campus are familiar with because we did it for 100 days, and that's incident command. It's an emergency management principle where you organize a way in which decisions can be made and things can be acted upon in a more expeditious manner. And we had incident command running for many months, a little bit more than 3 months. We shut it down. We're going to start it up again.
That's right, Dennis. We actually started it yesterday, the 9th. We're going to meet twice a week. The first thing that we're doing is we're reviewing our surge plan. So
Right.
we haven't had to act on anything in the surge plan, but we're reviewing it. We want to make sure everybody is familiar with it. And if there are any changes we need to make, and there are a few, we want to get that done now before we have to use the plan. So again, this is being prepared. We are being proactive as opposed to reactive.
Right.
Back in the spring, COVID just came on us so quickly, we
Right.
were very reactive.
Right.
We don't want to do that again.
It's like we said in the press conference, preparedness over fear.
Correct.
And that's one thing we're going to do here. Clinical and non-clinical people are on the table. So clinical folks, obviously, but also security and the people who represent the front end
Facilities.
staff, facilities, everybody
Yep.
will be there for that.
Absolutely.
Fred, these videos were born out of COVID. We started to do them as a way of communicating with our workforce. We know that they're an effective way of doing that. In that same vein, we've begun to organize the messengers that go out so that rather than having multiple different messengers a day, they're going to be put together in 2 times a day. But then
Yes.
if there's an incident command meeting, and again, you can describe the days they're going to come out, we're also going to set out a specific messenger to the workforce that says, here's what was discussed in incident command yesterday, here's changes that may be occurring, so that people can go to one source to get the information.
That's right, Dennis. So the schedule is going to be Tuesday morning and Thursday afternoon, end of day, for the incident command meetings. So we'll put out a messenger on Tuesday afternoon with what was discussed and decided upon on Tuesday morning, and probably on Friday morning based on incident command on Thursday afternoon at the end of the day.
All right, so people should look for those.
And they should be recognizable. They'll have incident command communication, we think, in caps.
Great, great. All right, let's end on some really great news. Let's talk vaccines. We've been talking about for a while here, there was 5 or 6 major pharmaceuticals that were in what's called phase 3 trials. That's the final phase where they decide if a vaccine is effective or not.
Yes.
One of those companies, Pfizer, released some news this week, which is great news, that said that the vaccine that they're working on had a 90% effective rate in preventing the virus. This is great news.
It really is. So this is a vaccine, Dennis, that requires 2 shots,
Yeah.
3 weeks apart. In their clinical trial, which has spread over multiple countries, so not just the United States, and a pretty diverse population, so covering all the minorities that have a disproportionate amount of COVID. They've had 94 infections, and they must be disproportionately in the placebo group. They, I think, have given this vaccine to both doses to almost 40,000 people
incredible.
in the study.
So this means that if it's allowed to be cleared by the FDA, we're probably looking at first quarter 2021.
Right.
We know it's going to initially not have enough vaccine to inoculate the entire world or the country, probably start with the vulnerable, but they'll be mass producing it, and it's hopeful that others will also create a vaccine.
That's right. Madeira is, I think, close behind them.
Right.
So the timeline of this, they should have safety data to provide the FDA later this month.
Right.
And then, probably shortly after that, the FDA will make a decision about an emergency use authorization. They've talked about having 50 million doses before the end of the year, and then obviously many, many more after the first of the year.
Well, that would be incredible. And we'll talk a lot about the vaccine, specifically when it comes to New York State, how it gets distributed, the order in which it's going to be given. But obviously, if you haven't heard, there's some great news out there about the vaccine.
And we should remind folks watching the video, Dennis, we have a group that's been working for at least the past month on our plan of how we're going to administer, track, report, all the things that are going to be necessary to deliver vaccine.
And if you haven't gotten your flu vaccine, get that as well.
Get your flu vaccine.
We're 100% vaccinated on this campus right
We
now,
are.
which is great.
Yep.
All right, so that's it. We're going to keep it on those topics today because we thought there was enough to speak about in those particular areas. And we'll come back again on Thursday with some more updates as well. All right,
Great.
good. Thanks, Fred. That'll do it. We'll see you in 2 days. We ask that you once again, please take care of yourself, take care of each other, and we'll see you in 2 days.